One of the things that attracted me to the Rome Foundation was they're sort of looking at things within the world of GI illnesses that not a lot of people traditionally look at. Functional GI disorders are a relatively new group of conditions. They're poorly understood, and the diagnoses behind them are not always made with a great deal of reliability. What the Rome Foundation has done is codify some of these diagnostic practices, come up with discrete entities that can be used to identify patients, the symptoms that cause them the most distress, and also focus those findings towards the development of appropriate treatments. I met Doug Drossman, the chairman of the Rome Foundation, at a conference, and we began to talk about educational opportunities and ways to disseminate the information the Rome Foundation was coming up with. And together we've been collaborating for a few years. So the new program that Rome is building in collaboration with LogicNets is basically an online interactive diagnostic and treatment protocol program. The idea is that any user with an account can log into the program and interact with the tool in multiple ways. One way would be purely as a learner, wherein there are several cases that you can start with, and by going through predetermined diagnostic pathways and answering questions as you see fit or based on past patient experiences, you can work towards a diagnosis. Then based on the diagnosis, the user can also work towards complete outcomes. Along the way, treatments can be recorded as being successful or as having a failure. And based on the outcome, a different treatment may be recommended. In addition to this, the program also takes into account psychosocial stressors. And this is especially unique for the world of functional GI disorders, where there's such an overlap with psychiatric illnesses. The other interesting thing about this program is it's really the first tool available for physicians that takes them from the initial diagnostic process through all the variables that are involved in diagnoses and then onto the treatment side. There's a lot of tools out there on the market that help physicians and clinicians of all kinds learn about various illnesses, but there's very few out there that can guide the diagnostic process. The tool is unique because it's web-based, so it can be accessed through any device that has an internet connection. But it also allows you to record data, and therefore you can use it in real-time clinical practice. A patient who comes in for the first session, you can sit down with them, take their history, and use that history to navigate through the diagnostic algorithm. And then you make some recommendations for evaluation, various exams, laboratory testings, or procedures. You can save your progress, and then a week or so later when the patient returns, you can pick up right where you left off and keep moving forward until you come to a diagnosis for that patient. The potential applications for this clinical toolkit are very wide. For starters, it could be used by any physician specializing in GI disorders to help navigate the diagnostic and treatment process for their patient. It can also serve as a guide for non-specialty physicians who suspect that their patients may have these conditions. While the tool doesn't substitute for the expertise of a clinician, it can certainly help guide the primary care physician on that pathway and help them make an appropriate referral. It can also be used as a screening tool. If, for example, in a specialty clinic, a non-physician is performing the initial screening, that provider can actually use this toolkit to help examine the patient initially. Therefore, when the specialist is evaluating the patient, they know exactly what has been done before they lay eyes on the patient that first time. Another application outside of the immediate clinical setting is the research setting. Because functional GI disorders are relatively newly diagnosed conditions and very newly understood, there's a lot of effort being made to identify new compounds that can help providers treat these patients. By having a standardized algorithm for both the diagnosis and the treatment, pharmaceutical industries and research organizations can use this tool to help guide their process. So that way, when a drug is being developed, it can slot right into the existing framework of treatment. I serve two primary roles in this process. The first is as a psychiatrist, I can provide insight into the psychopharmacological recommendations. These medications are frequently used by physicians who treat functional GI disorders, and as that is my specialty, I can provide a little bit more information about how and when to use these drugs. My second role is to serve as a liaison between the LogicNets team and the Rome team. With the LogicNets team, I help them understand some of the medical recommendations and treatment that the Rome Foundation is trying to put out there, and help them create the appropriate user interface that's most appropriate for physicians to use. When working with the Rome team, what I help them to do is understand the limitations of the current technology, but also how to best communicate the information within the framework that we've built through the LogicNets program. By bringing LogicNets team and the Rome team together, we've created a really unique product. The Rome Foundation Online Toolkit is the first of its kind to combine the diagnostic process and the treatment options all into one program to help clinicians better serve their patients.